My philosophy for patient care is treating the patient how I think I would want to be treated if I were the patient. I think informed decision making is a critical part of that process, explaining the risks and benefits of different treatments and procedures and just letting the patient map out their own course with their medical care, giving any advice that you think is scientifically helpful or anecdotally helpful, and just letting the patient really be the master of their care, being as informed as they can be. My interest in cardiology began as a first-year medical student. There was a cardiologist at the time at University Medical Center named Dr. Smith who volunteered a lot of his time to the first-year medical students when you're saturated with textbooks and tests and labs. And he took a lot of time out of his schedule to introduce us to clinical medicine and what it was really like to treat patients. Got us involved in the pathophysiology of cardiology, and everything built from there. I'm from Jackson originally and stayed here through high school when I went to the University of Colorado at Boulder for undergraduate. I came back to Mississippi for medical school where I attended UMC and then on to Vanderbilt for internal medicine residency. Following that, I went off to Charleston, South Carolina at Medical University of South Carolina for my general cardiology and interventional cardiology. My passion in cardiology is probably education. I spent the past 13 years at University Medical Center just down the street where a large part of my job was teaching the fellows there. Transitioning into private practice, apply that to patient education, trying to make sure that they understand what's going on so that they can be empowered to make the right decisions, and also educating the staff that are around me, and probably most importantly of all, educating myself, which is what led me into cardiology to begin with. Something about myself that most people probably don't know is I lived in a railroad caboose for 4 years during medical school. So if anybody has a good railroad caboose story, I'm the guy to speak to. I think my mission as a physician is similar to that of the mission of most physicians, if not all, and that's just patient-centered care.